Assalamualaikum warahmatullahi wabarakatuh. Hi, I'm Dr. Linda, founder of Skyhi Clinic Malaysia. I'm a certified advanced hormone therapy practitioner by International Hormone Society of Belgium and has been practicing for the past 10 years. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah kita bertemu sekali lagi pada hari ini, hari Ahad. Alhamdulillah 27 Jun 2021. Hari ini salam berhujung minggu kepada semua yang menonton. Apa khabar anda semua? Saya sekali lagi mendoakan kita semua berada dalam keadaan super sihat insya-Allah. Terima kasih kerana bersama-sama saya pada pagi ini. Thank you for tuning in. InsyaAllah kita ada speaker jemputan yang kita lah bersedia di studio pada pagi ini. Alhamdulillah, please join us and please keep sharing insyaAllah. Anda sedang menonton FB Live bersama Dr. Linda setiap minggu. Dan Alhamdulillah pada kali ini, minggu ini setelah beberapa minggu kita dapat lakukan pada hari Ahad, Masya Allah, atas permintaan ramai, dan doakan kami terus beristiqamah, terus istiqamah untuk meneruskan is a public awareness, kita panggil public awareness series session ini yang kita akan lakukan setiap minggu insya-Allah. Baiklah, topik kita pada hari ini seperti kita semua tahu dan kita semua maklum adalah wanita. Apabila ada wanita, mesti ada emosi, insyaAllah. Emosi itu perlu diurus, emosi itu perlu jangan ditangisi, but insyaAllah kita akan kupas dan kita panggil dig bersama-sama isu wanita dan kaitannya dengan emosi dan women hormone, insyaAllah. Ya, terima kasih sekali lagi. Waalaikumsalam warahmatullahi kepada Puan Nur Razilah Azizat, ya, terima kasih kepada anda yang bersama-sama kita. InsyaAllah keep sharing this. Right, so tak nak berbuang masa lagi, kita dah ada, sekali lagi kita dah tahu topiknya, kita dah tahu topik yang kita akan sharing kita pilih pada hari ini, dan tentunya tetamu saya pada hari ini sudah bersedia di studio. InsyaAllah saya dengan ini menjemput, please welcome Dr. Sangeet Kaur. Alhamdulillah.
Good morning, everyone.
Hi. Ya Allah, good morning my dear lady Sangeet. Dr. Sangeet, how are you?
I am good, thank you, and thank you
Good.
for having me.
Good, Sangeet. Thank you for accepting our invitations. You know what? We're doing this on Sunday. We hope you get more viewers, inshallah. Right. So how are you today? How was your running?
I'm feeling good, thank you. So running is part of my activity.
Good. So you had your endorphin high already, yeah? You had your endorphin very high already. Thank you. Thank you, they were saying, so thank you for the viewers also. They will say, good morning doctors, never miss your sharing. Yeah, thank you. All right, so why is this today? We are here, we have wonderful Dr. Sangeet as our guest speaker. Before that, Sangeet, I would love to introduce who is Dr. Sangeet. Sebenarnya kita ni dengan Dr. Sangeet dah sama-sama dalam seperjuangan Dr. Sangeet lagi senior lah, I shall say. Senior not in the terms of age, jangan salah faham. She's still young, muda and available. I can say that. Okay. But we both of us, I can say, has been exploring this industry. I don't say industry lah. This kita panggil
the field.
The field. The field ni. Thank you, Sangeet. For the past maybe 15 years or so, betul tak, Sangeet? Dr. Sangeet. But anyhow. Yeah, so anyhow, this is what we do. So let's introduce. So kita memang colleagues, kita pergi banyak seminar bersama, be it local or international. Memang ya. Dan kita punya speakers, and sesungguhnya if you want to know, Dr. Sangeet juga salah satu speaker where we train our local doctors to be in this industry, iaitu in the terms of nutritional medicine, integrative medicines, and of course in balancing hormones. Right, so with that, if we said that kita dah berkenalan dengan siapa speaker kita, so kita tak nak buang masa lagi, Dr. Sangeet, let's go. So maybe please say some words, Dr. Sangeet, why we choose this topic and why do you think the women's hormones and emotions are still related or so-called relevant to discuss this time round during these difficult situations. Am I right? Dr. Sangeet, do you know that in women we have two S. We need to have a safe environment and we need to have a next S is a system support yang very strong so that we make women very happy. Can I say that, Dr. Sangeet?
Yes, it's very much needed.
All right, over to you, Dr. Sangeet. Please say something before we start, please, my dear.
Okay, Dr. Linda, so I guess why this topic? Well,
Yes.
now with this pandemic, many of us have been affected in one way or the other. So some
Yeah.
demotivated, feeling low, feeling depressed, and many of our lives have come to a standstill. So I thought, staying safe at home, what can we do to increase the levels of our four happy hormones so that we can
Sure.
be happy? And we will dive deeper into all these four happy hormones shortly.
Betul. Thank you, Dr. Sangeet. Thank you for the kind introductions as such to the topic. Okay, let's go. Let's start this topic. Everyone is ready. Thank you, Cik Diana Ahmad. Dia kata inspired dengan kita ni dua-dua doktor. That's what Cik Diana says. So, bersemangat Dr. Sangeet yang cantik ini untuk keep sharing. Okay? Since dia orang banyak komen, cantiklah doktor kita ni. Alright, of course, I bring doktor-doktor cantik hari ni, pagi ni, of course. Let's go. So, Sangeet, Dr. Sangeet, please. So maybe we can go to the first questions and how we start with this discussion kan. Semua nak tahu dah Dr. Sangeet. Everyone want to hear now. We be with us this morning. Thank you Joanne. Thank you Elle. Thank you Puan Haslinda Abdul Kadir. Masya Allah. Right. So basically, since this topic is so much so affected women, and as we are women, as we know, and our emotions as well, which are women's hormones that affected in women emotions actually, Dr. Sangeet? Over to you.
Thank you, Dr. Linda. So basically, we'll be discussing more into the two hormones that makes a woman, which are the estrogen and the progesterone. And so, our emotions that we feel, whether it's pleasure or displeasure, it's all brought about by our neurotransmitters, which is the brain chemicals. And these neurotransmitters in turn are influenced, or it's impacted by our hormones. Now, how the hormones influences the neurotransmitter is via steroidal receptors. So what are receptors? So the receptors are basically they are proteins that sits on the hormones, on the cells, or on the surface or in, which actually communicates with the neurotransmitters. So coming to this, so what are emotions? So emotions are psychological states that's brought about by changes involving the physical self and the reactions to the mind. So these are in turn brought about triggered by the arousal of the nervous systems, which are brought about by the changes by the neurotransmitters, right? And neurotransmitters, as we know, as I mentioned just now, it's triggered by the hormones. So therefore, hormones play a massive role in governing our emotions.
Yes, Masya Allah. Yeah, to start with, Dr. Sangeet was trying to explain relations on the emotions being controlled so much by our neurotransmitters and the hormones as well, right? So that's to start with. I think she has prepared a very wonderful slides. Please stay tuned with us. Of course, she want to share more about that. Please, Dr. Sangeet.
Okay, could we go to the next slides, please?
Yes, please.
Thank you. So what are hormones? So hormones are the chemical messengers that is secreted directly into the blood, and it has its target influence on the tissues or the organs. Too much or too little can definitely result in a disease state. So our hormonal levels impacts the neurotransmitter secretion in the central nervous systems. And how these hormones, basically the estrogen and progesterone, influences the neurotransmitter is via a receptor. So what are the neurotransmitters? So these include the GABA, which is the calming neurotransmitter, serotonin, which is known as the happy hormone, dopamine, the reward and the motivation neurotransmitters, and glutamate plays an important role in learning and in memory. Yeah.
Good, great. Yeah. All right, so this is important. So we got to know what are the women's hormone, not just the neurotransmitters, right? Not just the dopamine and not just the other neurotransmitters, which is also important, but we have a quick, or we can dive in. What is it, the women's hormone that we love to go about? Please, Dr. Sangeet.
So mostly it's the balance between the estrogen and the progesterone. So the estrogen and progesterone, they are responsible for many reasons, and a lot of it is due to do with regulation of the menstrual cycle and development of the secondary sexual characteristics. What I want to actually highlight here is actually the estrogen and progesterone. It has to be kept in the balance at all times. So if we tend to have high estrogen and the low progesterone, it leads to a lot of hormonal havoc. So how I can explain is basically the hormones are like a symphony orchestra. When one of it is out of balance, the entire performance can be disrupted. So this is true with our hormones, especially the estrogen and progesterone. So these days and age, we tend to see a lot of women that suffer from hormonal imbalance. So the conditions that they get impacted with is basically polycystic ovarian syndrome, fibroids, endometriosis, and many more. So Dr. Linda, I'm sure you see a lot of these cases in your clinic as well. Can you share something with us?
Wow, Sir Sanjeet. Yeah, I guess that we've been going day to day managing women's hormone, Dr. Sanjeet, and I believe same goes to you, right? So these
Yes,
are women that come to us every day with a complaint or seeking for help. I shall say, look, doctor, I'm so much so depressed. Or I'm so much so feel very tired. I become very angry easily. I can't control my anger so much, even with my little kids at
yeah,
home. These are very simple, and they are also women leaders, Dr. Sanjit. Right? When I say that, women leaders, where they have their business to take care. Even they have being mothers on its own, Dr. Sanjit, is maybe not the easy. I mean, a lot more challenges nowadays with the current
yes,
situations, and
yeah,
yet they come and seek for help. That's why I can say congratulate to those women out there, Dr. Sanjit, where they don't come, they don't keep to themselves. They it's okay to shout for help. So
yes,
Dr. Sanjit want to say that, look, yes, we've been seeing that a lot of women's having that issues, hormonal and emotional issues, and yet the good thing about that, they shout for help.
yes. So there's a lot of awareness, and they are aware that something is not right in their body. So I
Yeah,
think we always need to listen to our body, and when we know that something that's just not right, all we need to
sure,
do is actually to reach out. Okay.
sure, you're
So
right.
yes. So I guess probably we could discuss into the effects of estradiol or estrogen dominance, and
All
maybe we can
right,
see the slides. Yeah.
correct.
Yes.
Mm-hmm.
Okay. So now we're talking about the estrogen. Now, the estrogen basically it increases the serotonin, which is the happy hormone, and the endorphins. The endorphins is known as the feel-good chemical, therefore boosting the mood and the libido. Now, it's very important that estrogen must always be counterbalanced by progesterone. Remember, we spoke about the balance. So, if you have a high estrogen and a low progesterone, it both needs to be balanced. Otherwise, it leads to hormonal imbalance and it leads to a lot of mood disruptions. So, the common conditions are basically premenstrual syndrome, where the clinical symptoms are basically headache, anxiety, irritability, breast tenderness, and bloatedness. Now, 75% of women who have menses, they tend to suffer from mild premenstrual syndrome. So the next one is the premenstrual dysphoric disorder, which is known as the PMDD. It's a more severe form of PMS, where the
Mm-hmm.
quality of life is impacted and one is not able to perform a task, be it at home or at work. Now, the other one is, which is quite common, is actually the postpartum blues, which is a milder form of postpartum depression, which inflicts
Mm-hmm.
women who just delivered. So they tend to have. So what happens in all these three conditions is the hormone levels tends to, especially the postpartum, tends to dip. There is an imbalance, and the common thing about all these three is they tend to have low progesterone. So that's how important progesterone plays, right? So
Wow.
high estradiol can lead to headaches, mood swings, and irritability. So it's all about the balance.
Mm-hmm.
So can we go on to the next slide, please? Okay, so this slide, it depicts that how estrogen, it actually influences the neurotransmitter serotonin, which is actually the happy hormone, right? Can we have the next slide? Okay, so progesterone, we've been talking about progesterone since just now. So this is actually the calming female hormone. So besides the role in the reproduction, it significantly influences the brain, right? So deficiency in progesterone results in recurrent migraines, anxiety, and sleep disruption. So progesterone counterbalances the action of estradiol. So while the estradiol is an excitatory, it has an excitatory effect on the brains, the progesterone is just the opposite. It has got the calming effect. So progesterone has an anti-anxiety effect, basically by activating the GABA receptors, the GABA neurotransmitter, which keeps a person calm. And the GABA is basically an inhibitory where it assists in relaxation and sleep. So if you see the difference, the estrogen gives a person more energy, increases the libido, uh, feels happy. So progesterone is needed to counterbalance. It keeps a person calm.
Yeah.
Okay. Yeah.
Right.
So can
Wow.
we go to?
I like the calming hormone, Dr. Sangeet.
Yes.
Mm.
So it's very much needed. It's it's a lot of people tend to have low progesterone, therefore the anxiety, the irritability every time it just kicks in. So,
Mhm.
so it's not the end of the world. It can be addressed, and you can lead a better life, quality life. Yeah.
Sure.
So this graph over here, it shows that progesterone, its effect by increasing the GABA receptor activity in the brains via its metabolite, which is the allopregnanolone.
Mm-hmm.
So basically it's all about the GABA that keeps the person calm, and progesterone is actually needed. So low progesterone will result in headache, depression, and weight gain. Can we have the next
Mm-hmm.
slide, please? Yeah. Okay, so this particular picture, it shows that the woman, it's how they literally look and feel when they have an obvious imbalance between the estrogen and progesterone. So she literally has high estrogen, which is estrogen excess or dominant, and progesterone is literally needed. So she looks irritable, she is highly anxious, she's agitated, and probably she did not have a good sleep at all. So progesterone is needed in this case.
Wow.
Yeah.
Right. All right, Dr. Sanjeet. I think Dr. Sanjeet has talked about all these two women's hormone, two important women's hormone, I shall say, which is the estrogen and progesterone in maintaining women's emotions. Am I right? So it's so much important. Dr. Sanjeet was trying to explain just now. It should be always be balanced. Right? We don't want it to be too much estrogen. We don't want it to be too low estrogen, or we don't want it to be too high progesterone, or most of the time is too low progesterone. So the opposing the E and P is so much important. Yes, we discuss. We welcome questions. Thank you, viewers. We have questions for Dr. Sanjeet. Thank you. Just type at the comment. Just type dekat ruang komen that your questions, so that kita akan raikan, kita akan entertain the questions by as Dr. Sanjeet finish her sharing session. Yeah, boleh? So just keep going, keep typing the questions so that we can entertain later. Right, Sanjeet? So by Dr. Sanjeet dah discuss tadi, and we love to know what are the other happy hormones, Dr. Sanjeet. Make us happy by knowing the other 4 happy hormones. Please, over to you, Dr. Sanjeet.
Thank you, Linda. Okay, so the first happy hormone is the oxytocin,
Right.
the
Good.
bonding hormone. So now the oxytocin is also known as the love hormone, as it increases bonding. Now, oxytocin is released when we share our affection, our emotions with our loved ones or with others. Now, so oxytocin, it evokes the feeling of contentment, calmness, security, and it reduces the anxiety. Right.
Wow.
So deficiency in oxytocin leads to anxiety, depression, poor social communication, and depression. Yes. Yeah. So what can we do now? I know that, while social distancing is really important at this point of time, uh,
Sure.
yeah, the most natural way is by hugging, touching, relating to one another, or even hugging our pets. All this will increase or release the oxytocin. So the other ways are basically by exercising, meditating. Yeah, that's fine. That's fine. We can go to the next. So the other happy neurotransmitter is actually the endorphins. So the endorphins
Mhm.
are known as the feel-good chemicals, right? And why? Because the endorphins, it blocks the pain and allows us to feel pleasure. So how do we increase the endorphins naturally? So obviously by exercising, by dancing, laughing with our family and friends, reading comics, and watching comedies. So these are the
Wow.
things, and it's all available. You can do all this at home, right?
Sure.
Yeah,
Mhm. During this lockdown, we can do that also kan, Dr. Sanjit? We can embrace or practice that activity kan? Macam laughing kuat-kuat dengan family, as you said. You just had your endorphin this morning, you were running. I belum dapat my running this morning. To be true, seriously. And I
yeah,
think this is you, Dr. Sanjit, sebab pagi tadi dia dah running kan? So this is how Dr. Sanjit look like lah. Before started off the session. So Dr. Sanjit, I think that's what we can practice at home now, as what Dr. Sanjit was trying to say. Even kita tak boleh keluar, kita tak boleh enjoy. So much so di travelling kan, tak ada
yeah.
pleasure activity, we can do that. Betul. Dr.
Yep.
Sanjit, teruskan.
Yeah. So basically, it's everything we can do from home. We can make use of our Netflix. We can read books. We can read comics. And you can just put on your dancing shoes and just dance, right? So all can be done at home. Yes. So can we go to the next neurotransmitter? Okay. So dopamine is the motivation and the reward neurotransmitter. It's involved in focus, attention, memory, and learning. Now, dopamine is released when we perform a certain task, be it small or big, it doesn't matter. So, what else can we do at home to increase the dopamine? So,
Wow.
as you realize, when we shop, it's very rewarding. Why? Because it releases the dopamine, right? And other things that we can do is by organizing our home, keeping our homes clean. It may not be as fun as shopping, but it definitely increases the dopamine. So there you go. So all these
Right.
are basically, you tend to any task, any goals that is accomplished, it releases the dopamine. It's we just get motivated, we get driven, we get rewarded. Yeah. So we can move on to the next, which is actually the serotonin. It's known as the happy hormone. Now, the deficiency in serotonin, it causes low mood, depression, anxiety, and it has the antisocial behaviors. What is interesting about serotonin is that 70 to 90% of it is produced in our gut. So our gut is known as the second brain. So there is a connection. There is the gut-brain connection. So it's always important to look our gut and to eat healthy. Granted, we can have our cheat days, but overall, it's very important to eat healthy, right? So all the healing starts from the gut. So what can we do to increase our serotonin levels? So firstly, when we share a certain advice or knowledge or even simple things like recipe, it increases the serotonin. Now, giving back to the society or to nature via assisting, donation, volunteering, all these will increase the serotonin levels. Exercising, meditating as well. So all this is basically the simple things that we can do.
Wow.
Yes, yeah. So meditation, meditation tends to reduce meditation or exercise reduces stress. So that plays an important role. Yeah. So I've gone through and I've discussed the four happiness hormones, which is the endorphins, the dopamine, the serotonin, and the oxytocin.
Right. So I call it the anatomy of happiness, Dr. Sanjit, right? So I love to call it as because it has all these important tasks and a role when we have doing activities and all these hormone kita memang akan activated and dia akan happykan badan kita juga, right? So thank you for those who are typing the questions. Please keep going. Kita akan entertain the questions soon, ya. So Dr. Sanjit, so let's go. So macam kita nak buat all these hormones tinggi, how we going to do, what else that kita nak dive in, that apa lagi aktiviti yang kita boleh lakukan dengan keempat-empat hormones ini? Please Dr. Sanjit, over to you.
Well, you know what? If I look at all these four happiness hormones, the one thing, hormones / neurotransmitters, I guess the one activity that can increase all of this is actually dancing. So ladies, put on your shoes and dance away. Right?
Puan, I tahu. This one I tahu. Dr. Sanjit memang suka dancing. Please, we have more followers that Puan Azamila kata dia pun love dancing, Dr. Sanjit. Right? See how we can do that.
Dance away. Yes.
Tak tahu menari pun menari je. Salah tempo pun tak apa.
Joget saja, joget. So exercising covers everything, So these are the things that we can do. Exercise is important. Do whatever that keeps you calm. Be it meditating, be it yoga, whatever.
Wow. Dr. Sanjit ada explanation je in the next few slides, I guess. Over to you, Dr. Sanjit.
Okay, so this slides, it shows the four happy hormones that I was talking about, and what can we do to basically to elevate these levels. And these are the summaries, and like the endorphins is basically by exercising, even by dancing, by meditating, or even laughing, right? And the dopamine, anything that is rewarding. So by keeping things organized, cleaning your home, by shopping. And I think everybody loves shopping because we actually feel the reward, right? Yeah. So I guess the next slide would be on the serotonin, which is the happy hormone. So this is anything that we could share knowledge, share any advice, going out and helping others in whatever way we can do, via volunteering or via donations. All this will increase our happy hormone, right? And the oxytocin, which is actually the bonding hormone, is the hormone of love. By touching, by hugging our loved ones, it increases the level very naturally. So with this, I thank you, Dr. Linda.
Yes, Dr. Sanjit. Thank you so much. She has explored that the four main happy hormones and the two women's hormones on balancing or affecting women's health, especially the women's emotion. The one that for me and for Dr. Sanjit and who practicing balancing hormone and nutrition, we are very much so embrace this by patients or women know your hormones, right? Kenali hormon anda, especially when we talk about estrogen and progesterone. At any age you are, even umur 30-an ke, 40-an ke, or even dah menopause age kan, Dr. Sanjit, kita perlu tahu our level of hormone. Do you agree, Dr. Sanjit?
Well, I totally agree with you, Dr. Linda. Sometimes we just don't go and check our hormones just like that, but there will always be certain symptoms that when in your body, right, that will actually, we will go and we will seek help from the professional, and it's up to them to actually to ascertain what is the cause of it. But I don't disagree that we see a lot of this hormonal imbalance among the youngsters these days, as early as 20s or even in their 30s. So most of them are involved in estrogen dominant. So one thing I would like to highlight is about the xenoestrogen. So the xenoestrogens are estrogen we find in the environment. It could be due to pesticides, herbicides, and the plastic containers. So there's a lot are a lot of estrogen in our environment, and they are also known as what we call it as the endocrine disruptor,
Hmm.
because it causes hormonal imbalance, and it can lead to a lot of diseases, including cancers. So I think this is something that we need to be more aware in our environment.
Yes, Dr. Sanjit was trying to explain about xenoestrogen, which is we call it the endocrine disruptors, that we are living in toxic worlds. We are exposed to these toxics around us, right? Be it what we eat, be it what we put on put on the body or the personal care. Am I right, Dr. Sanjit? Be it
That's
whatever you exposed to, because xenoestrogens not just from what the food, it also from the stress and sugar. The two S are always mentioned, right? Stress and sugar also disturb or so-called imbalance the women hormones, hence getting that estrogen and progesterone become imbalanced. Betul, Dr. Sanjit? Right?
yes.
So read a little bit more about estrogen, xenoestrogen, which is, yes, we would love questions, ladies, viewers, so we can go one by one, insyaAllah. Dr. Sanjit dah ready, let her kita tengok satu persatu, boleh? So maybe I can see here few of the questions. Dr. Sanjit, maybe we can open for questions, yeah? No,
Yeah,
is it
sure. Go
alright for
ahead.
you?
Go ahead.
Good. Okay, boleh. So I think that's a few more yang kita boleh discuss, tapi as I said, sebab kita tak tengok patients, right? Kita boleh discuss how much that we can talk dekat sini, ya. From Ashling, yes, she's a breast cancer survivor. Thank you. And ER positive ni certain type of breast cancer lah, ya. So I know the estrogen dominance which causes this problem, right? Tadi kita baru je berbincang pasal imbalance of the estrogen and progesterone. Remember E and P tadi, right? So apabila dia out of balance, yes, it may causes this one of many factors, not the only it, kan Sanjit? So now how to have this estrogen and P become balanced? Sure, kita boleh discuss this, right? So what else? What are the lifestyle that we would love to embrace, Dr. Sanjit? What are your advice about food that maybe not only for Ashling, those who have, yes, we hear you. We hear you that you have already suffered from breast cancer, but before women having one breast cancer, we can practice or embrace that already. Betul? So over to you, Dr. Sanjit. How would you love to balance the estrogen and progesterone?
Okay, so this we are not talking about the cancer part of it, and
Yeah, not related to that.
yeah. So basically, I always talk about the 5 pillars of health. It starts from exercising, what you eat. So I think the gut health is very, very, very important. As I mentioned, that
Wow.
it starts from the gut, right? And if you can go with all the organic food, that would be a better option, because it is supposed to be less herbicides, less pesticide, less chemicals on it. And by balancing your hormones, if you have a certain symptoms and you are diagnosed to have hormonal imbalance, it's just addressing the root cause and balancing what is totally out of sync. Now, the vitamins and minerals, sorry, are also very important. So exercise, as I mentioned, and ultimately you have to address the stress, because I think the stress, a lot of us are living in this very stressful environment.
Stressful world.
Yes, very stressful world, and so whatever that we can do to go within to keep ourselves calm, and it's just an overall healthy lifestyle.
Wow. Betul. I agree. It's a huge topic on its own. But Madam Ashling, ya, it's a huge topic on its own. Kita mesti we apologize that kita tak boleh cover the whole thing. But what's in general that Dr. Sanjit was trying to say, and I may put some input also. Yes, in regards to cancers, there's so many ways we can do, and we can embrace and practice. Betul? Not just the diet, the food, nutrition, you know it, and even balancing the hormones itself need a very good gut health. Kesihatan usus yang sangat baik and superb. Alright, because gut is always, Dr. Sanjit did mention, as a second brain, is almost associated dengan immunity juga. Okay, how importantnya gut and immunity towards one's body. Betul? So I also agree with Dr. Sanjeet. Kita also seek for help. Apabila you want to know your, yes, you want to know, you jangan don't berteka-teka. Don't say that maybe I have estrogen imbalance. Maybe, betul tak Dr. Sanjeet? Kita selalu think that way. Maybe I have this. Or maybe when you read or you hear from somebody else, you always say, oh, maybe I have that also. But why not you do the testing? When we don't test, when we don't measure, we don't know. That's the gist also we're going to say. Not just yes, what else to move on to be on doing it. The questions is always like that. I hope menjawab ya, Madam Ashley. But good to test your estrogen and progesterone now. Right? Yes, we agree with you. We hear you. You are survival. You are very strong, Ashley. But moving forward, you know what to do. Boleh? So maybe kita go to the next question. Dr. Sanjay ada nak add on? I think you're good.
Yeah,
Boleh?
actually, I forgot to mention that I think it's very
Ada add on?
important to eliminate sugar. It's very important to eliminate the sugar or any
Wow.
of the white food. So the white food being the white rice, the white sugar, the white flour, anything that is related to very high or processed food, high carbs.
Look at that.
All nutritionally, they are all sufficient. It doesn't give us any benefit at all.
Wow. Look at that. No benefit at all. So that's it. So again, the white poisons, the sugar is truly, again, I said there's two S, the white sugar and the stress, really damaging women's hormone, right? And hence it's become imbalancing of the estrogen and progesterone. Okay, Dr. Sanjit, can we go to the next questions? From Joanne, right? What is the natural way of maintaining progesterone? I guess it's about the same as what Ashley was saying, but this is maybe in particular to progesterone, right? A few things that we can do. I shall say few things that we can do to support progesterone by having good food. Maybe kita boleh discuss sikit. Maybe Dr. Sanjit boleh add on a little bit more. What are the natural way, Dr. Sanjit, to maintain or balancing high or good level of progesterone?
Well, I think one of the good ways is actually by making sure that we are not estrogen excess or estrogen dominant.
Sure.
So all the xenoestrogen by eliminating our, the toxic environment, the plastics and the pesticides, the chemicals. It's just not from the food, as you mentioned, Dr. Linda. It's also how much of makeup that we use, the perfume that we use, right? So all this play an important role as well. And everything, we go to the basic, which is all the gut health. So I guess when you do all those things, you will probably have quite a healthy progesterone levels. Yeah.
Wow. So that's again ya, Madam yang bertanya, Joanne, is still sekali lagi the diet. Dr. Sanjit was trying to say, ada banyak diet yang improve the progesterone that high in magnesium, B vitamins. Am I right, Dr. Sanjit? And zinc. We can add on that also.
Okay.
That's I said, yeah, that's very important to in terms of diet. Right? How else that improve women's progesterone, right? Next, that means reduce your we call it phytoestrogen. Betul? Kita tak nak yang banyak in phytoestrogen kan? All those, nanti you can look into it, yeah? What are the food that high in estrogen, yeah? Madam Joanne. And Dr. Sanjit mentioned about diet and exercise. Very good. So just be on the move. Buat some movements. Exercise is just not getting your exercise attire and be in the gym. Whatever Dr. Sanjit was trying to say was really good in exercising or movements. Exercise itself comes from the word of movements, betul tak? And of course, other ways to remove or manage the estrogen is managing the progesterone. Managing stress, betul? Stop smoking, yes. All the habits kan? And some medications also can kacau progesterone juga. So the natural way of maintaining, tak nak ambil all the non-natural home drugs. Boleh? The medications, what I mean. So other alternative medicines macam some herbals also helpful in maintaining progesterone. Right? You can look upon that some good herbs that also good in maintaining progesterone. Right, so actually banyak lagi Dr. Sanjeet kan kita nak discuss again sekali lagi. Madam Joanne, our questions to you, make sure you know your progesterone level, right? I hear you before you say what's the natural way, Dr. Sanjeet, Dr. Linda, to maintain the progesterone, but make sure you know what's your progesterone. If you know, congratulations, right? And move on from there, right? Thank you, Madam Joanne. InsyaAllah. So we go to the next question. Just a simple one, tapi kita boleh buat a little bit discussion sebab it looks very best lah. Very best meaning that I nak tahu, maybe women viewers nak tahu lagi apa itu estrogen in general, benda-benda macam tu kan. So maybe from Madam Nur Jihan Jafar, very straightforward, quick questions. We can answer yes or no je, tapi kita nak elaborate sikit lah, is estradiol is estrogen? Dr. Sanjeet, over to you. Dr. Sanjeet, expert pasal ni.
Dr. Linda, yes, Nur Jehan. So estradiol is estrogen. It's the same.
Simple as that kan. So sebenarnya ada 3 estrogen. Ada 3 kita panggil 3 form of estrogen dalam badan. Boleh? Dia ada E1, dia ada E2, dia ada E3. Betul Dr. Sanjeet? Kita semua orang maybe betul clear about this I type dulu ya. Ada E1, E2, E3. Yang estradiol ni is E2. Boleh? Ada type kat situ ya. Tidak ada tuliskan sikit semua maybe yang tak dapat insya-Allah. So the estradiol is E2 punya form of estrogen. Estrogen tu macam big umbrella kan? Dr. Sanjeet. So you want to add on Dr. Sanjeet please.
Yes, so basically there are 3 types of estrogen. Is the E1, estrone. Now the estrone is not the good estrogen, so we always avoid that in terms of replacement, bioidentical hormonal replacement. Now the common ones is actually the E2. So the benefits of E2, which is the estradiol, is that it gives us the energy, the feel good. It affects the way we look, the collagen, our hair, our energy.
Wow.
And the E3, which is the etriol, is always the protective estrogen. It protects our breast, it protects our uterus, and it's more like a lubricant. It keeps our skin more moist. It prevents dry eyes, dry vagina. So all the estrogens, these 3 types, basically it has its benefits, but we usually focus on the E2 and the E3. And the take-home message is the E1 is basically it's not so good estrogen because it is the metabolite, which is the breakdown from the estrogen.
Correct. Ya. So in general setiap satu ni ada tugas masing-masing ya. Saya yang bertanya Puan Nur Jihan, maksudnya E1, E1, E2, E3 ni setiap satu ada tugas dia masing-masing dalam badan. Cuma dia itulah dia akan lebih panjang lah perbincangannya. Cuma selalunya kalau kita selalu mention about E2, estrogen ni senang nak sebut. Okay, macam Dr. Sanjeet dah katakan apakah tugasnya. Alright, thank you Puan Nur Jihan. Harapnya membantu soalan daripada Puan Nur Jihan. Okay, let's go. Well, I think I have to congratulate Miss L. Can I show this? Miss L kata test done. Jangan guess. Macam itulah. So that means she's done the test. Okay, congratulate Miss L. Okay, so after that, maybe kita before pergi Ashley ada another questions, maybe kita boleh tengok another one questions from Jiwa. I'm not mistaken, sorry kalau I pronounce different silap I pronounce your name dia kata sorry out of the topic, but does essential oil yang maintain natural progesterone to mimic body's progesterone help? What is your say, Dr. Sanjeet?
Wow, you know what? I'm not an expert in essential oils.
Sure. We may not answer those questions. Tak apa, kita ada some views kan, Dr. Sanjeet? Over to you.
Yeah, but I do know that those who use the essential oils, they do say that it does increase progesterone naturally, but I honestly don't know. Yeah.
Okay, so kita maybe at our expert level kita ada beberapa yang kita boleh jawab, ada yang tak perlu jawab, so not to worry kan. So don't worry Puan Jiwa, kalau kita ada informations on this, we'll share you further, we'll share you more. Is it okay Dr. Sanjeet? Boleh?
Yeah, that's fine.
So,
it on a certain link or website, we can do a bit of a research and we can get back to them. It's not a problem.
Betul? Yeah,
Yeah.
that's it. Okay, we go to the next question. Thank you for Madam yang bertanya tadi. So let's go to the next one. From Puan Kus, hi doc. For this estrogen and progesterone hormone testing, do we need to go on certain cycle day to get those checked? Thank you, Madam Kus. Over to you, Dr. Sanjeet. What is your say?
Yes, so basically, if you do have a regular cycle, it's advised to do it between day 18 to day 21. And the reason we do between the date 18 to 21 is because that is the luteal phase. And the luteal phase is when the progesterone is usually at its peak, its optimum. So if let's say your levels are low at that particular time, so which means that the rest of your menstrual cycle, your levels are actually low. But if you don't have a regular cycle, you can do it at any time because we can't pinpoint on the day 18 to day 21st.
Correct. I think I agree with you. Right. So we can go round to the next questions. Boleh? A few questions from. We have two questions or few more questions from the same person. Maybe we go round dulu ya to the previous next question so that kita boleh go the next one. Inshallah. Right. So from Sarah. Is the recurrence, Sarah, thank you for joining us. I guess it's a few times Sarah is joining my FB live session. Thank you, Sarah. Sarah was asking, is the recurrence of uterine polyps fibroid due to estrogen dominant? If yes, what are the changes one need to take? Thank you, Sarah. You are on track, not to worry. Okay, so over to you, Dr. Sanjeet. Why is it important to maintain estrogen dominant, and is it true? Is this one of the many risks of estrogen dominant towards the fibroid?
Yes, so Sarah, to answer your question, yes, it is due to estrogen dominance, and the changes that we need to do is all that we have discussed just now. So if your estrogen dominance and if your progesterone is low, then you need to supplement with micronized progesterone that will help to bring your estrogen levels low. Now, estrogen dominance, there's also, certain foods that we call as the cruciferous foods, where it's there's a particular active ingredient. It's called the DIM, diindomethane. Now, actually reduce levels. Now, these are found in certain foods, cruciferous, which are the cabbage, cauliflower, broccoli, and Brussels sprouts. And just lead a healthy lifestyle and try to reduce the xenoestrogens in your environment. I hope that helps.
Yeah, I think that's pretty much important, Sarah, because before we even got we do agree that even women, before you know your estrogen dominant, let's say you don't test your blood, make sure that you eat healthily kan. Tapi once you know the estrogen dominant already, so Dr. Sanjeet was suggesting, of course, take your cruciferous food, betul? Yang high in broccoli, take it every day. Yeah, it helps also metabolizing the estrogen yang kita tak nak tu, that we don't want. Sorry, Sarah, the one that we don't want, the excess estrogen, it metabolize completely, or it metabolize good in our liver. Betul, Dr. Sanjeet? That's why we want that high-rich DIM or I3C foods tadi. Okay?
Yes.
So it helps. There are many ways to help our liver to shed off or metabolize this estrogen. Many ways, right? You can look up into it. But one of many ways is having good tinggi kandungan indole tricarbinol ataupun DIM tadi. Dr. Sanjeet ada mention. Yeah, yes. Right. So maybe one or two last questions, Doctor. And she was trying. Ada someone kata, I lump together. Yeah. Can we shrink fibroid by getting our hormones balanced? Aduh. Okay. So maybe this one.
Yeah. You know what?
Get another one.
Yeah. Fibroids is actually a bit more difficult. It's not very straightforward and direct if you compare to things like PMS or endometriosis. Fibroids is a bit tough. It's a bit
Betul,
tough.
yeah. But get yourself check, Puan Nojehan, ya, get your OBGYN, doktor pakar sakit puan check dulu dan buat tahu. Yes, it ongoing balance your hormones kan? Betul, we can do that. Alright, maybe last.
Fibroids.
Betul,
Right? So
prevent further. Betul. I agree sangat Dr. Sanjit. Okay. Maybe L, one more from Miss L tadi. Miss L tadi tak tanya questions lagi kan, tapi tanya tadi komen je dulu. Miss L tanya, doctors, ni better. Oh sorry, not this one. Sorry sayang. This one, mana L punya. Okay, this one Dr. Sanjit. Any relations between insomnia, ya, tak boleh tidur malam dengan imbalance-nya estrogen dan progesterone. Over to you Dr. Sanjit.
Yes, Ms. L, it's definitely related. So insomnia is one of the symptoms of low progesterone. So to get your levels checked and your progesterone is low, clinical symptoms will already tell me that your progesterone is low. So you need the micronized progesterone. That will help. Yes.
I agree with you. So that dia become balanced tu faster kan Dr. Sanjit? Mesti dapat the micronized progesterone. Betul, right? So
sorry, one thing. And going back
boleh.
to the slides just now when I mentioned about progesterone and how it actually it increases or it influences the GABA receptor. So the GABA
Look at that.
It also helps to relax and sleep. So hormones and the neurotransmitter, they communicate with one another. So that makes a difference.
Okay, Al, I think menjawab soalan Miss L tadi. Yes, and many ways for you to improve your insomnia. Also, if you have any issues or need more help, please talk to your doctors. Yeah, Miss L. Okay, maybe we can go one last questions, or I don't say this is a questions. Maybe kita congratulate the second comment from Ashling. Actually, yes, I've cut down carbs and sugar from my diet. Super awesome, Miss Ashling. Yeah, and mainly vegetables and protein. Yes, change lifestyle by sleep early and move around doing exercise. On list of supplements, of course, superb. And minimize the content of xenoestrogen. You have done great and superb. Hope I'm on the right track. Of course, you are on the right track.
Yes? Go, girl.
You're very much so. You're doing great. I think it's not easy. Yeah, better said than done. Betul tak, Ashley? We must have very good and strong willpower to do this, and we know you can do it. And all of us women, we can do it. Okay?
And this is all part of self-love. So we need to love ourselves.
Masya Allah. See? Some of self-care and love. Betul tak?
Yes.
All right, team. Maybe I can ask my team that maybe ada any more questions since we are coming to 12 o'clock. So I think ada satu atau lagi dua yang kita boleh. Wow, congratulate Dr. Sanjit. See, Puan from Norhana, I ambil progesterone 150 dah setahun, almost 1 year she's on progesterone. I feel good.
Okay,
Superb, duper. Yes. Go. I think I have one more on this, Sanjit, so that we can call it a day. All right, let's go. What are the indications in terms of hormonal imbalance if you experience bad menstrual cramps? Bad menstrual cramps ni also kita panggil dysmenorrhea, ya, sakit ataupun period pain apabila sampai waktu period itu. Betul? Sakit semasa period. And I don't feel good every 2 weeks in a month, going through terrible cramps, intense throbbing pain. Right? Puan how do I say, Puan Zah, ya, Puan Zah, we try to help insyaAllah, tapi soalan-soalan begini ialah soalan diagnostik, ya, maksudnya kena jumpa doktor baru kita boleh tahu what we can do or what we can move from there. Kita boleh kena buat pemeriksaan, further history taking, tapi maybe Dr. Sanjit will help to add on sedikit sebanyak that we can help. Over to you, Dr. Sanjit.
Yeah, sorry, Ms. Gabo, I guess when you mentioned that you do have severe cramps, which is dysmenorrhea, I'm not sure if you have heavy bleeds, which is menorrhagia, they're all linked to low progesterone. So it sounds like you need progesterone, but please go to your doctor and get your hormones checked.
Sure, I agree with Dr. Sanjit tu. It sounds macam estrogen dominant juga, ya. Estrogen dominant tu indirectly macam tak cukup progesterone lah, ya. Indirectly, ya, Gabor. So basically, Zah, you need to just not sit on it, get help from your doctors insyaAllah, and do your tests, and we can balance your estrogen and progesterone, right? Memang it sounds like estrogen dominant kan, Dr. Sanjit?
Yes.
Alright, with that, I think, wow, we have a few more questions. Or maybe Sarah, I can say this to that Sarah say thank you for doctors. I will have daily steamed broccoli. Wow. I also don't take a daily tau Sarah, broccoli and Brussels sprout. I mean,
Very
we
good.
try our best to be on, alternating all these cruciferous veggie kan. Tapi oh, I think I like this idea. Kita buat steam kan. We know it. Tapi itulah dia. Nak buat hari-hari tu tak semestinya. Itulah dia. Strong willpower kan. Alright. So maybe I think kita raikan questions. Thank you ladies. Thank you ibu-ibu, wanita-wanita yang menonton kami pada pagi ini. Thank you so much for asking the questions and to our speakers actually. Sebenarnya kita dah almost come to the end, dah pukul 12 dah pun. Maybe my team boleh tengok ada tak soalan yang kita maybe perlu bantu dan perlu jawab, sebab kita boleh beli masa sikit lagi untuk kita wrap up the session ya untuk hari ni. Right, so maybe Dr. Sanji ada, okay, maybe last one. Assalamualaikum and good morning. Wow, maafkan saya, Sungai Limau ni kat mana? Boleh komen sikit tak? Kita nak tahu Sungai Limau ni kat mana sebenarnya. Maafkan saya, apologize for my ignorance, tak tahu daripada mana, tapi don't worry. So soalan daripada tadi, apa katanya? We miss maybe with this question first lah. Is estrogen and progesterone supplements, or kita panggil BHRT supplements ni, are lifelong intake? What's your take, Dr. Sangeet?
Okay, so it depends. It depends on your age. What are your problems? Are you menopause? Are you not? So it really depends. So for example, for those who are menopause, it's basically you don't take it like, in a month, you don't take it like every day. You do have a hormonal break. For example, you take from Monday to Fridays, and the Saturday and Sundays you take a break. So that mimics pause. So that is like how your body usually regulates. And for those who want to stop, by all means, they can always stop and see how they feel and what are their symptoms, whether they have a quality of life or not. So at the end of the day, when we supplement, it's all about what we call it as a physiological dose. It's not too high a dose. It's just a small dose that is just required for you to go on with your life. That is produced or secreted by your body. So it's all based on what we call it as the physiological dosage to be safe.
See? Right? Yeah. So always monitor. Betul tak, Dr. Sangeet? Not
Yes.
just to take lifelong, tapi we don't monitor. That's always important. Do every year medical checkup to know your level. Dr. Sangeet agree? Even you're on these two BHRT, estrogen and progesterone, sometimes it may be dah overshoot ataupun kita kata dah cukup kan, so we may reduce or adjust accordingly your kita panggil your dose. Betul? So not to worry ya. So we hope menjawab soalan from madam yang bertanya. Masya Allah, ya Madam Kus, kami ialah essential service lah sebab kita klinik kan. Ya, masa MCO pun kita buka insyaAllah ya. We do help women yang nak buat medical check up, nak tahu level hormon, boleh datang insyaAllah ya. Alright, so itu saja soalannya. Masya Allah, kita dapat ada yang almost saya rasa daripada jauh pun dah ada all around Malaysia, I shall say. Ada seorang dia jawab ni, saya daripada Kulim, Kedah. Masya Allah, Puan Sharifah Robatu, Masya Allah, daripada Kedah. Thank you for joining us sekali lagi ya. Daripada Kedah juga yang tadi Sungai Limau itu, daripada Kedah juga. Thank you so much again. Thank you and good morning doktor katanya. Syabas, congratulations daripada Perpustakaan Desa Kampung Sungai Limau, Kedah. Itu yang Dr. Linda tanya tadi, Sungai Limau ni daripada mana. With that, I would love to thank Dr. Sangeet, tapi Dr. Sangeet sila beri kata-kata, maybe kata-kata terakhir untuk wanita yang berada dengan kita pada pagi ini. Dah almost tengah hari pun, Dr. Sangeet, please say some words to them. Over to you, Dr. Sangeet.
Hi, I guess, so first of all, thank you for listening in. Thank you, Dr. Linda. Thank you everyone for tuning in. I guess the gist of, or the take-home message today is, it's all about hormonal balance. If you feel that you have a certain issues, and please do go seek help, get it checked,
Wow.
the levels, and at the end of the day, it's all about a quality life, and all this is not, it's not the end of the world. It can be addressed, so just do the right thing. Yeah, that's it.
Correct.
Thank
Thank
you.
you Dr. Sanjeet. Saya dengan ini memang sangat berbesar hati pada semua doktor yang dan Dr. Sanjeet sendiri dan saya diri sendiri, dan kita kata saya sangat menyahutlah cabaran wanita-wanita untuk kekal sihat, dan kita panggil untuk bersama-sama untuk sihat sebab kita semua mahukan kesejahteraan yang sebab nak hidup lama kan, nak lifelong, insyaAllah boleh berbakti kepada masyarakat dan kepada negara, insyaAllah. Dan Dr. Sanjeet, I accept your thank. Memang saya yang kena thank you Dr. Sanjeet for accepting our invitations this time round. It will not be the last one Dr. Sanjeet. Yes, it will be the first, but it may not be the last one. We call you again if you have more demands from the viewers kan, nak tanya lagi pasal soalan hormones dan women hormone and emotions ni sangat besar topik kan Dr. Sanjeet. It's a huge topic on its own. Kita boleh pecah-pecahkan supaya kita boleh do the subtopics, what I mean, so that kita boleh cover most of the topics on empowering women. Boleh? With that, minggu depan, please join me again. So ini adalah topik minggu depan, sama masa, same time, same place. Alright. Another doctor in the house that we can invite, Dr. Iman Talia, yang akan bercerita pakai topik kulit pula Dr. Sanjeet. Right? Hormones dan wanita tak lari dengan perkataan kita panggil kecantikan, betul? Sebab whatever we do selama hari ni is about internal kita panggil within, kesihatan daripada dalaman. Okay, so with that saya rasa please join us next week ya, so boleh keep your date bersama-sama dengan saya dan tetamu jemputan sekali lagi. With that Dr. Sanjeet, ada little closing from me. Love ourselves because we need to love others. Betul? Jaga diri, jaga emosi, selebihnya Allah bantu insyaAllah. Dengan ini saya sudahi dengan wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh, and bye everyone. Bye Sanjeet.
Bye-bye. Thank you. Bye everyone.
Okay.